welcome to PhDizzle. I'm your host, Alice Chang, and today I'll be interviewing Sumun Khetpal, who studied biology and healthcare management in a dual degree program at UPenn and Wharton, got her MD from Yale, and is now a plastic surgery resident at UCLA. Hey Sumun, thank you for joining me today.
Thanks, Alice, for having me. It's a pleasure to be on with you.
I want to start back at the beginning. You've had a very amazing career journey so far, but let's talk about what actually influenced you to go into medicine.
You know, my interest in medicine really stems from being in a setting where I grew up watching my parents practice medicine. I was brought up in a small town called Durant, Oklahoma, tiny town north of Dallas, Texas, and spent a lot of my after school time with my parents at their clinic, at the hospital, watching them care for patients. My dad's an interventional cardiologist, my mom's an internist, and you know, being providers in a rural area has its own challenges. You're sort of going above and beyond for patients. Not only giving them medical care, but also, psychiatric care, social care, and really thinking about practicing holistic medicine, caring for the patient as a whole. And, you know, being able to speak with patients about their own journeys and stories and illnesses and families. I really had a rich childhood that really served patients as if they were, my own family. And having that sense of nobility within the profession and watching my parents really excel as community members really inspired me to think about medicine as a future career and think about ways to solve problems for patients beyond the biological, thinking about the social determinants of health, thinking about the role of food insecurity, thinking about housing, thinking about transportation, and brought that mentality of just thinking big, but also, you know, being grounded to serving patients in my education.
So did you know when you already went to undergrad, were you like pre-med? Did you know that you wanted to go into med school after?
I actually had the opportunity to go to boarding school when I was 14. So I left Oklahoma quite young. My brother and I had a great opportunity to really expand our horizons and attend Phillips Exeter, which is a boarding school in New Hampshire. There, I was very keen on pursuing medicine, given my upbringings, but I was also very bold, in thinking about different aspects of healthcare, thinking about global health, thinking about human rights, but really wanted to use an MD and, be grounded as a physician and apply that, expertise in medicine. When I came to Penn, I was actually fortunate to be accepted into a program which was actually a dual degree program between the Wharton School and the college. And I was, really excited to explore the business side of medicine. So thinking about healthcare policy, thinking about insurance reform, thinking about the role of entrepreneurship in healthcare, the biotech industry, how is healthcare paid for? How do health systems work, not only within the United States, but abroad? And how can we apply different principles and different payment systems to enhance access, quality, and lower the cost of care? So I was always keen on pursuing medicine, but I was really interested by these other aspects and ties to the field. And of course, gave my, interest to all these aspects of healthcare. But I realized that being a physician, you're sort of at the center, you're the key opinion leader that all these stakeholders report to. And I wanted to be in that position as the patient was the primary source of motivation for me to help patients, but also understand the context of how healthcare was delivered.
So you ended up going to Yale for your MD. And I guess tell me a little bit about why you chose Yale and how you discovered plastic surgery, because that sounds like it's a different path than what you were originally, like you talk about health systems and things like that. So connect the dots for me.
Yeah, there are a lot of dots to connect there. So a lot of my interest at Penn was really in healthcare disparities. As a junior, I actually founded a startup called Ride Health with a few peers, and this company was dedicated to tackling the transportation barrier to care, because even if you provide the best care in the world, it really doesn't matter if the patient doesn't have a way of accessing that care. But transportation barriers are rampant in every field of medicine. So when I decided to attend Yale, I was really keen on internal medicine, which is the field that my parents came from. It was kind of a natural inkling of most medical schools train their students to pursue the field, and it sort of dovetails well with healthcare policy interests and healthcare disparities. But Yale really, allowed me to explore other fields through research opportunities and more flexible systems and elective opportunities to look at and consider other fields. So I just happened to be in the OR watching one of my mentors, Dr. Persing, who is a world-renowned craniofacial surgeon, doing many procedures, cranioplasties, which involves reconstruction of the entire skull for a syndrome called craniosynostosis, of seeing, cleft lip and palate repairs, and really saw plastic surgery as this really transformative specialty for pediatric patients, for their families, and not only restoring function, but also the aesthetics and just the sense of quality of life. The field is endless and evolving. You hear about facial transplants. Those are done by plastic surgeons. The first solid organ transplant was done by a plastic surgeon. There's also gender affirming surgery, which I had the opportunity to really foray in as a medical student. I did my thesis on chest masculization surgery and have interest in facial feminization surgery and rhinoplasty. So, plastic surgery is at its core, it's applying surgical principles of wound healing, of reconstruction, but also has this really compelling side of creativity and, I would go as far to say entrepreneurship, in the way that every surgery is different. It keeps you on your toes. It's just a very exciting opportunity to operate on anyone of varying levels of need, from aesthetic to trauma to those who are battling breast cancer, for example, and would always keep me, creative and nimble, which I really appreciated and loved that parallel with my, past life. My choice of Yale was amazing because the school really allows you to build your own curriculum and focus on what you want to focus on. So I was able to pursue Ride Health, the startup, for the first 2 years of medical school. And by that time, the company was doing so well, and I was able to pitch for the company, help raise funds for the company, and also, make the decision of pursuing plastic surgery, which is a pretty, big commitment, through a lot of engagement with research mentors, the section, and really, trying other fields as well.
Tell me a little bit more about Ride Health. I was actually going to ask that as the next question, and you kind of preempted it. So you were such an amazing experience that you got to continue from Penn into Yale. And I thought it was just a Yale thing. So that's awesome. So tell me about that experience, in terms of like transitioning from, I guess, just like an undergrad into hey, this is a cool project that we're starting. And now it's like, oh my God, we're raising money. And oh my God, this is a real business. And then transitioning kind of back into medicine, being like, okay, I do still want to pursue medicine.
Yeah, there were a lot of decision points along the way. I'd say Ride Health really took off in my last year of undergrad. I, was really fortunate to have a great team of folks, Vedant, Christine, and Imran, who is currently the CEO and runs the company. But in 2017, I was really active in pitching Ride Health to a lot of local investors in Philadelphia, New York, taking a lot of Amtraks, and really putting our name out there. I'd do a lot of cold emailing through high school networks, college networks, you name it, we had tapped the network to get leads for health systems, and just have that, 10 to 15 minute meeting with that C-suite executive. We focused on Penn Medicine initially, and was able to organize pilots in health systems in New Jersey and Philadelphia. I was working at a small VC fund when I was applying to medical school. And, with a lot of tooth pulling and pitching and discussion, we were able to secure a pilot investment from them and, got our first angel on board who happened to be a Wharton professor. And, then we were accepted to Startup Health, and things really snowballed from there. I think the inflection point was when my co-founder went full time in May of 2017. And, my first 2 years of Yale were really focused on building this company. Of course, I was learning medicine too in a preclinical setting, but I wasn't going into the hospital quite yet. So I had this almost grace period, which I think really worked out in my favor to build this company, a lot of Zoom calls and virtual discussions. But I wasn't, working on the company in terms of its operations. I was working on it from an investor relation, from a perspective of hiring and high level strategy during those 2 years. But as things evolved, my interests changed. I, decided that I had extracted as much learning as possible from this experience. And I'd also given pretty much all of my, connections and everything that I could to the company. I was at full capacity. So, there was a decision point in which I really thought about my future and how plastic surgery was my future. And, Right Health taught me so much about leadership, managing teams, being able to think very strategically, professionalism, these really fundamental qualities that were so applicable to any future company, let alone a surgical career, would entail in the future. So I think it also allowed me to advocate for patients on a more sustainable level, which that's what my goal had been, since I was very young, thinking about one patient story, one, issue that a patient was facing, not having a ride, to building a solution to help that patient, but also millions of patients with that same issue. So wanting to take that thesis to plastic surgery, and, who knows what the future will hold for that. But I was very grateful for the Right Health experience.
Not too long after Right Health, you actually started something different. So continuing in the entrepreneurial journey, can you tell me a little bit about that?
Yeah, so, during COVID times, we all took to our own families, mental health even, and wellness. I think, the virus really opened my eyes towards what my priorities were as a person. I was really fortunate to be taking my board exams at the same time, so I didn't really lose out quite much, for my hospital electives. But I really had this opportunity to spend time with my family and reflect about where I wanted to go in the future, preparing my application for plastic surgery, but also thinking about entering the world of entrepreneurship again. I didn't have the capacity to build another for-profit company, but I was thinking of ways to reconnect with my friends, particularly from undergrad, around a problem that I knew that they were passionate about, and that was the women in healthcare leadership problem. The fact that women make up the majority of the healthcare workforce and probably the majority of medical school and graduate school student body, but are not represented as such in leadership roles. They receive a minority of VC funding across the board in healthcare. And I think the COVID pandemic has really exacerbated these disparities, with women, publishing less, really having their career on the back burner. And we decided to form Theia, which is a nonprofit dedicated to inspiring and empowering women to change healthcare. Through entrepreneurship, innovation, we've extended our reach to advocacy and policy as well. And For me, I'm a bit early in my career, but I thought my perspective as a student founder, as someone who wasn't quite established yet, but had a sense of how to start a company at a young age, maximizing resources in a university setting. I had a lot of, tokens and advice that I could spread to people who are maybe considering those things as well, those steps. So with my two co-founders, Shubnam and Irene, who brought a lot of experience from the investment banking consulting worlds, we decided to build this community, which is now, growing rapidly, of investors, of entrepreneurs, student founders to public company CEOs, to really demystify and democratize the process of building a healthcare company and spotlighting women in that process, and also minority founders in that process. So we host a podcast like yourself, Alice. We've interviewed so many student founders, CEOs of public biotech companies, in mental health, in infertility, in immunotherapy, in a lot of social determinants, addiction medicine, you name it. It's just been a very fulfilling experience to hear about their personal journeys, struggles, and what their take is on entrepreneurship and making it as a woman. What are those subtle biases that we face that we need to keep in mind and even leverage to our advantage as we're pitching our own company? So it's been a very exciting experience. We've built a team of almost 20 people at this point, not only dedicated to the podcast, but also building a curriculum or framework for entrepreneurs to look to as they think about filing patents, to marketing, to building a website, to launch, and also a mentorship program, which we have called Agora, which has been really, really successful, particularly this summer.
Can you tell me what Thea and Agora mean?
Yeah, so we're really going with the Greek theme. So Theia is the Greek god of light and vision. So we wanted to really embody this spirit of enlightening people to really leverage their own expertise and amplify their own mission, hence Theia, and just this idea of spotlighting women who are so successful in healthcare and the life sciences. Agora is by definition a meeting place. So most of our meetings are virtual, so it's a virtual meeting place, although we will have some upcoming meetups in Los Angeles, in New York, in Boston, because we are a national team. We're all spread out. We've never actually met each other all at the same time. So those are the two terms defined for you there.
Awesome. Well, it sounds like such a great mission. And it's great that it's nonprofit. You don't have to worry about pleasing investors or, like where you're going to get your next round from. And people are in it to help other people and make it a better place. So that's amazing.
Yeah, I like that flexibility that we have. We can make it what we want. And we're really capitalizing on undergraduate entrepreneurship communities. We have interns from Yale, from Wharton, from Georgetown. Lots of schools are represented for us, and we're just so grateful to have expertise in design and social media, and I'm learning so much. But I think in the future, beyond assembling this network, which in itself is so important, I'd really like to entertain the idea of building kind of an investment arm of the organization. So more to come on that, but I think Theia will be a platform for all of us to really think about supporting women, not only through providing resources and network, but also funding.
That's awesome. That would be great. So you're super busy with Theia, which it sounds like it's an amazing opportunity. Also with your residency, thank you for doing the interview. Let's just note that you just pulled an overnight shift. Do you have downtime? What do you like to do? What are your hobbies?
Yeah, Yeah, I think being a resident for now, like 2 months, I'm getting used to being able to really maximize my time off, and really focus on wellness. I'm really into exercise. Really fortunate to live in Santa Monica, which, has a really nice park right across the street. Huge fan of the Peloton. I was sort of late to the game, but I'm pretty religious about it at this point. I love how each workout is so efficient. It's something that it makes exercise so much easier. I enjoy water sports, so hence another reason I'm so lucky to live in California now. Trying to learn how to surf, but not yet tackled, but hopefully next time we talk, I will be working on that. I cook. I really focus on spending time with family and speaking to them. Travel used to be a huge interest of mine. Of course, it's been revised, so a lot of road trips and photography on those road trips. So I just try to maximize every moment, be grateful, connect with friends, make sure they're doing okay, and just taking a day at a time. It's a very unique transition that I'm navigating, and it's a cross-country move, so I'm getting my bearings still, but really focusing on myself and just making it through each day, and serving patients in the best way that I can. And also learning how to suture, learning how to, be in the OR and learn from my attendings and fellow residents.
Amazing. I love that perspective. And I did want to bring up the fact that you grew up in Oklahoma, but then spent a bunch of time in the Northeast, New England, and now are all the way on the West Coast. Kind of a fun question that I don't want to put you on the spot, but maybe one thing that you love about California or Santa Monica, and one thing that you miss about your hometown or maybe the Northeast.
Everyone keeps asking me that because I've dabbled in each part of the US, and I'm really grateful that I have that sampling before I make the decision of where I want to build my career. I say in California, it's the sunrise and the sunsets when, I'm awake as a surgery resident. Sometimes I don't catch sunrise, sometimes I'm too early and it's dark. But man, the drive to the hospital with the light, through the trees and the ocean, is just fantastic. I'm really grateful for just the weather in California. It makes all the difference. Something I missed about the East Coast is just that quaint, kind of cozy feeling. New Haven's a college town. I miss the fall. People are already getting geared up for, the leaf changing and the foliage. So I think I'll miss that feeling the most, and that sense of, New England quaintness. And of course, Oklahoma has always been near and dear to my heart. I always miss my family, my grandparents. I have a very nuclear family that's really focused in North Texas and Oklahoma.
PhDizzle.
MDizzle. Having fun with smart people who do cool things.